Beyond the surface of self care and fleeting emotions, World Mental Health Day urges us to delve deeper into the subject. Joining us today is Dr. Ananya Sinha, a distinguished expert in the field. As the founder, director, and chief clinical psychologist at Therapy, Dr. Sinha brings over 10 plus years of clinical experience and holds the status of an international affiliate member of the American Psychological Association. Her extensive expertise is reflected in her research contributions and academic work, which are published in international journals. Let's talk about mental health with her today. Ma'am, thank you so much for doing this again. And the first thing that we want to know is, can you tell us what comprises of mental health for our audience? Like, what are its components and what is actually mental health?
That's a very interesting question, Akshata, because when we talk about health, there are so many aspects of health. But the moment we use the term health, we think of physical health, right? We think about if I'm feeling good, the feeling good is always in terms of how we are feeling physically. We do not usually ask ourselves, or when we are asking somebody else also how you're doing, we usually do not expect an answer in the context of mental health domain. So, mental health is more about how you're feeling at this point of time, whether you're being able to perform to the best of your abilities or potential, with how comfortable you are with your feelings. Are you being able to navigate through difficult circumstances? Are you being able to process your emotions well? So, a good mental health is a state not where there is absence of negative emotions. That's not what good mental health is. Good mental health is an awareness of your experiences, an awareness of your feelings, an acceptance of what you're going through, being able to navigate through and process those feelings, and being able to work based on your maximum possible potential.
So, ma'am, how can we take care of mental health in our everyday lives? Like, for someone who has no knowledge about mental health, what steps can they take in their everyday life to, just keep a tab on their mental health?
I think it's sometimes it is like simple things that we, for example, when we talk about a physical health, right, we think of what we are mindful about what we are eating when we are sleeping and other things. So similarly for mental health also, if there are certain exercises or certain things which you include in your daily life, very simple things, like we often associate exercise with physical health, whereas exercise actually is something that is very good for your mental health. If you're exercising, you release endorphins, which is very, very good for your mental health. It increases your positive feelings. So having a even if it is 10 minutes period of exercise, any kind of movement of your body, be it walk, be it anything, that is very, very helpful. Also, we often suggest that if you have a sort of morning ritual, our day-to-day lives, we have become so busy. I think we start our day, the first thing is we look at our phone, we check the emails, we check the messages, and from the bed only we start our day working. So that if we change, if we really slow down our mornings, and to slow down our mornings, it also means that we should be able to prioritize ourselves. We should be able to uh, uh, tell ourselves that this is a priority, this is important. And when I say slow down the morning, it is like really starting your day by just sitting, sipping some water, thinking about what are the things you're looking forward to during the day, doing a little bit of breathing exercise. Some people also include yoga and meditation, which is very helpful. And really enjoying your breakfast. If you're staying with your family, if you're, spend some time with your family, and then move into your day-to-day work, which means that check your phone after the morning has started and not before. So that slow start is sometimes helpful. And same goes for nighttime ritual also. If you really keep your phone away, really give yourself some time. I think many of us are so busy doing things, working, interacting, updating on Instagram. We don't really spend times with ourselves, with the moment. So the hobbies are sort of getting depleted. Simple things like, reading, listening to some music, spending time with your family, relaxing, a little bit of self-care, all these things are part of a good mental health. And lastly, a balance between, your work-life balance, that is so essential, really focusing on that.
Ma'am, there is a lot of stigma related to mental health in India. be it in terms of how we look at disorders or even in general stress related. There's a lot of stigma even to going to a psychologist and seeking help. Can you share some of the stigmas that have come across, that you have come across in these 10 years of your experience, and the importance of breaking them down, especially today when the cases of mental health are rising in India? So,
Right, right. So I think the stigma first, I would talk about how it started from my family. Like, I started this journey of psychology now, I think around I don't know, close to 18 years, 20 years almost back. So the studies and all these things. So at that time, that was also, I think times have not really changed a lot, but that was really a time where everybody will either become an engineer or a doctor. So anything like coming from a science background, like choosing to get into the field of psychology was a big thing for my family to accept. I think that is how you become aware about the stigma. Even somebody's choosing a profession, you're thinking, why mental health? Nothing is going to happen. And then you hear conversations around, right? Not only from your family, but from others in the society. Like the more you're into the field, while I became more and more aware of what the field offers, I also became more and more aware of the stigma that is associated with the entire concept of mental health. So the major stigma that people carry, I think, is that as if think like all the mental health condition or the difficulties that you go through, these are like very much easily manageable. So if you're sad, people will say, oh, why are you sad? Do something, you will feel better. So that something, this is something we all now talk about. This is now we are talking about conversation point, that this is not the right way to talk to people, that when somebody wants to talk, you should create that space of communication. But I think in general, mental health is always, since it is not too apparent, if somebody is sad, it's like we have seen people not feeling the most healthy mentally, yet being able to come to work and do that and expected to do that. But if you have fever, people will tell you that, you just take care of yourself, get some rest, take a medical leave. Nobody will tell that take a mental health leave and really take your time to get back to work. So the main stigma is in the understanding of where mental health issues arise from. They are, like we say, it's a component of biological, environmental, and some like personality issue, like all coming together. So if you look at the model, there are like genetic components, biological components, there are some precipitating factors. So many things come together, but nobody chooses to be anxious. Nobody chooses to be sad. It is something that is happening. And the one who is really suffering the most at that point of time is the person himself. Like, just to tell, like, why are you sitting with a sullen face? It doesn't help because the person doesn't want to sit with a sullen face. So stigma is about understanding that the mental health conditions are not something by choice. Like when you have fever, you're not choosing to have that. Similarly, when you are experiencing anything, be it sadness, be it anxiety, or any other, like there are so many aspects of mental health, even procrastination, everything. It's like it's a huge gamut that people are not aware. So we need to first understand it's not by choice and then really try to build awareness. So something that we are writing off as like labeling the person as a lazy person and somebody is not committed, somebody is not interested, not proactive. We should also somewhere try and see why, because nobody wants to be that lazy person. It's very difficult to accept also that I'm not being able to complete my work on time, not being able to deliver, not being able to go out with my friends.
so basically, this whole idea that we don't see where the mental health issues are coming from in our everyday lives is like one major stigma, and we should start trying to observe people and be more empathetic, right?
Right, right.
Also, ma'am, like what measures could be taken, to spread awareness? Because nowadays, we see that stress-related disorders are increasing, then addiction, alcoholism, the whole idea of with digital well-being and digital presence, those are increasing a lot of self-esteem problems among people across all ages, online bullying and student suicides. So, what measures? What are some of the measures that can be taken for to spread awareness about these?
Mhm. So I think all the issues that you told, like they all are like huge um, points of conversation. And there are like, when we talk of measure, there are like so many things that we can take for each of them. But if you look at it, like, for example, when you talked about online bullying or like these things are coming because there are multiple reasons, but one of the reason is that the facelessness, and that I can say anything and I'm not seeing what the other person is feeling based on that. Like there's no really that kind of social feedback that you're getting. Like because of my words, this other person is being impacted in that way. So there is this facelessness from both sides. And that probably comes from a point of, we thinking only from the way we are looking at things and not really seeing from how others are experiencing and perspective taking. So if we, it's very difficult to really summarize all the steps and actions that can be taken for all these issues, but the starting point can be empathy. If we are kind and empathetic, if we try to really ask, like, what is it going on? What might be leading to this person doing this? A little bit more tolerant, a little bit more willing to listen to the other person's story. And listen means really listen, not really say. Most of the times, if you see, people are saying this is bad, this is good, very labeling sort of, we are judgmental and we are labeling things. But if we really open up to the idea and ask open-ended questions, that I have lately seen that you are, usually had you're like this, you're very jovial, but I'm seeing you a bit low. Is there anything that you would like to talk about? Is there anything that is bothering you? And I'm here to talk to you about that. So being there for someone, even if you see the digital part, like people are spending so many hours just scrolling past the thing. It's almost like the dopamine hit. You constantly need that dopamine hit. It's like any kind of digital addiction, or let it be any other form of addiction. Addiction is actually a way by which you can protect yourself from the reality. You are trying to not, it's so difficult. The reality is so difficult at times that you need something to protect yourself from the reality. So engage in either some activity, like we are scrolling past the reels all the time, or it is some substance, or it is something else. But it is more about the addiction has a very negative connotation, but there has been such wonderful work by Dr. Geber Mate on addiction, where it's so beautifully told that how our trauma pushes us to a need to protect ourselves, to safeguard us. All we are looking for is a sense of safety and a sense of, like, the dopamine is gives us a sense of happiness also. So we are looking for that, and that is why peer people are going into that. So the real question is, what is under the reality that is so difficult to be in? That's why we need that space, the safe space to be behind. And here I'm trying to be also very careful about my use of words, because nobody escapes from the reality. I think sometimes when we use the terms like, they're just escaping, they're not facing the reality. It's not like that. If we go by the polyvagal theory of trauma, we know that we need safety. We are constantly looking for safety. So when there is any kind of difficult, traumatic, challenging events in the environment, our brain will always look for safety. So that safety is what these activities or these substances provide us. So if we are trying to really help someone, it has to start with a place where we always used to talk about this unconditional positive regard in psychology, which is more like you believe that the other person is good, and you show them unconditional positive regard, come what may, a non-judgmental space. Like however easy it is to say, these are very, very difficult spaces to be in, but constantly reflecting on, what you're saying, what would be the implications of what you're saying, and how, what really willing to know what the other person is going through, and trying to understand the other person's journey. That empathy and compassion can really take us a long way, and not see these issues as, issues that is happening to others cannot happen to us, and we are just talking about it from a distance, but not really entering into that space. Really take asking ourselves, what can I do? If I have 10 people around me, how am I treating those 10 people? How am I being with them? That might actually make a lot of difference. You're on mute, I can't hear you.
Yeah, stopping the labeling aspect of it, that this person is this.
Right,
Can you give
right.
some ways of how can we create a safe space for others, be it colleagues or even our family, friends, everyone? Because usually in our everyday life, we are so disturbed. We have so much going on in our personal life that it's very difficult to be empathetic also, even though we want to, but it's not easy to think from the other person's point of view. What can be done for that?
I think a little bit of awareness, like if we are mindful about what we are saying, how we are saying, that is the starting point. First, we need to know what we are doing, and then only we can decide, okay, this part we may want to do differently, this part we may want to continue. Asking others how they are feeling, trying to read through people's expressions also. So if you're seeing a person feeling a bit uncomfortable or not willing, not opening up, not really pushing, and being very careful about jumping to conclusion. I think what we often do is we jump to conclusion, or we sometimes you know very unintentionally make certain comments like, oh, you've gained so much weight, oh, you're looking like this, or a joke. Sometimes, like, we don't know what the other person is going through, so these words stay. So if it is about making the other person feel safe, it is about being non-judgmental yourself. If we strive to be as non-judgmental as possible, so if we use the term safety, I think the first thing that comes to our mind is, okay, can I go and say anything to this person and not be judged, not be critiqued, not be told about what else I could have done, not be given advice on which I'm not ready to take right now. Then only I will feel safe enough to be with that person. And safety doesn't always mean you have to talk. If you're with somebody else sitting beside, and even if you let the other person just be, that is also an action that leads to creating a safe environment. So we feel that we have to do something, sometimes not doing something, sometimes just being there, a message that I'm there, or sometimes through some action, like if you're seeing a colleague not doing that well, you don't have to go and ask, okay, what is it? Talk to me. We are here. Sometimes you can just go and take a cup of coffee and say that you care, and not say anything. You come back. It need not always be so direct and verbal. It can be subtle, but it is more about. I think the best way to do it is ask yourself, how would I want to be treated by my colleague? How would it feel for me to feel safe? And then do the same for the others.
Also, there are a lot of myths related to therapy, right? Like, not every person goes to therapy. Therapy is only meant when you have a disorder or something. Can you tell us about it? What is therapy, and what are these myths, and why it shouldn't be believed on?
I think the biggest myth therapy has is that if you have a mental health condition, that is when you go to therapy. And people talk about it very crudely. If you ask, like, even with the best intention, if you ask somebody, like, well, why don't you try therapy? And they're like, am I mad? And that's the first thing. So I think this connotation of, mad, or I'm psychologically disturbed, sometimes people think of it as a weakness. That why do I need to go to another person to solve some issue? So I think we need to understand first that therapy is not solution, and therapy is not a space where people go when it's not about the labelings, like the perception that we have mad and all this. It's all a myth. It comes probably from the lack of understanding of what mental health is and how it impacts people's socio-occupational functioning. So the main aspect of mental health is like, are we being able to optimally function socially and occupationally? Like, socio-occupational functioning is a very important criteria of mental health. So I think what therapy is a very safe space where your therapist along with you will take a journey, which you are taking, and try to unravel some of the experiences with you, so that what will happen is you will get better understanding of your experiences, why you are experiencing what, and then you only will be able to sometimes figure out what could be the best way forward. Your therapist might give you certain ways by which okay, this could be one of the things, this could be one, like, lay out the options, lay out the path, and like discuss with you. It's a very collaborative process, so you're sort of sitting with someone who is very non-judgmentally exploring things along with you in a safe space, so you can go back to your difficult memories also, and then come back to. Then this person, of course, has to be trained. So a friend cannot be a therapist. So whatever I'm saying that we do is something that is a result of 10-15 years of training and rigorous training that we have. So it is more about being with that person who is trained enough to help you navigate through your experiences, gain better understanding of your experiences, of your emotions, and then work towards how you would like to be in the future. what choices you would like to make, how you would make those choices, how you can regulate certain emotions, how you can express and channelize certain emotions. So it is a very, very safe space to be. And you don't need to wait for something to happen where it's not like symptom oriented only. You can also be helped when you're trying to make sense of what you're going through. It can help you understand yourself better, your life better, and hence a lot more in control of your life journey. So therapy therefore is for all. It need not be categorized to those, with some people who need it. We all need it. And it is not a sign of weakness. It's actually a sign of strength and courage to be able to be vulnerable in front of another person.
Also, ma'am, there are many challenges to seeking help or accessing mental health services in India. Like there are lack of psychologists, the affordability. Not everybody can go and afford a therapy session, and then there's pseudo psychologists as well who are not professionally trained. Yet they might just have 1 month some course experience and then they claim to be a psychologist and then they treat people, which again messes up their entire mental health. So, what are some of the measures that can be taken to solve these affordability and availability issues of mental health care?
Okay, I'll probably start with sort of explaining who a licensed trained psychologist is, because that is something people, and in this world of, digital world, everybody is a therapist, and that is really becoming a concern. So, like I said, being a clinical psychologist requires many, many years of training. So you have to go through your graduation, your post-graduation, then do an MPhil. Only after you do an MPhil in India, you get your RCI license, and then only you're licensed to practice as a clinical psychologist, period. If after your master's you're practicing, you can practice as a counseling psychologist. Now, the limitation is counseling psychologists are not trained in MPhil. MPhil is a residential course that happens in hospital settings, right? So it's very rigorous for clinical conditions. So counseling psychologists are equipped to work in non-clinical conditions with like whoever doesn't have a non-clinical, doesn't have a diagnosis. And we also have psychiatrists who are doctors, specialized doctors who are there to prescribe medications. So therapy will be done by clinical psychologists, medication prescription will be done by psychiatrists, and also we need to understand that there is a range of disorders. Some are neurosis where the reality contact is intact. So you for that there, and also in these, like sometimes medications may be required, may not be required. So only when you go and see either a clinical psychologist or a psychiatrist, they will be able to tell you what is best for you. And there are some other conditions like psychosis where reality contact is affected, where in conditions like schizophrenia and bipolar disorder, medications are very essential. So then you need to have a team of psychiatrists and a psychologist, clinical psychologist. Now, coming to the accessibility part, I think the reason why I started therapy is that was one of the major things that was bothering me, that it is like mental health services are so important. One in four will have a significant mental health condition during their lifetime. We are a country of 1 billion. And how many psychologists? I'm not even saying the number because it is
Very
terrible.
uh,
So accessibility is important, because the one of the thing that affects accessibility, it's not just the number, it is also people's way of, like, there are so many people who told me that if we have to tell our office that we have a therapist appointment every Monday 2 p.m., if I leave my office for that, what will I tell them? What will they think? So that stigma is also one of the deterrent factors of accessibility. Sometimes therapy is a long drawn process, right? It's like every week you'll have to see your therapist for an hour. So then continuity is important, but then continuity becomes a concern that, because sometimes it's your work and other things. So accessible platforms, like for example, therapy is an online platform. And we have a range of therapists, all are licensed clinical psychologists and psychiatrists. And since it is online, people are being able to access our services at a time which is convenient to them, from a place which is convenient to them. So that is one of the ways, if we can actually make our services accessible, like the platform which you're using. Having said that, all conditions are not suitable for online therapy. So offline therapy also is important, and that is where the stigma part comes in. The more we create awareness, the more we talk about mental health openly, the more we are addressing the stigma, people will be okay with, going and seeing, let's say, a urologist as easily as they will see a psychologist. So that is where the other aspect of accessibility comes in. And affordability, now this is a tricky one, because like I said, it takes so many years of training. And then when we are seeing a client, it is not just that 1 hour that we are devoting. There's so much reading that we have to do, so much time we spend with the clients because we prepare, and then it's a human interaction, right? It has an impact on us. We also need to do our self-care to prepare for the next session. So it's not just that 50 minutes or 1 hour that we are giving for the session. It's like hours altogether along with the training. So there is, like everything, any good service that we provide, it has to have a particular cost. And having said that, what we try to keep a range. So for example, if you go to therapy's platform, you will see that there is a range and people can choose based on what is suitable for their budget. But it is also about, we need to understand the other part of it is also the therapist sustainability. Like that is the, if you want good service, the person also needs to feel motivated and have to survive and sustain. So if you look at it, if like 4 sessions at a particular, if you see the amount that you're spending on therapy, it may be the same amount you might be spending on a 1 day's dinner out. But it is just a decision at that point of time that, do I want to commit to this? If you look at it more as a commitment for your health, it will probably become easier. So the affordability is more of an affordability in terms of the what you are thinking. At the same time, we know that we are a country where there is a different socioeconomic status, and people from all socioeconomic status should have accessible, affordable mental health services. And we are also a country to have, be lucky enough to have so many government hospitals. Like there's NIMHANS. You see, there are like the charges in government hospitals are very, very minimal. All you have to do is just go there, and that is quite affordable. There are many clinics who run low fee clinics. For example, there's an organization called Green Oak Initiative. They have low fee clinics. So all organizations, I think, try in their own way to have a space where they are making mental health services accessible to all the you know uh,
People across
ranges
all
of population.
spectrum.
Yeah, yeah.
Also, ma'am, nowadays people like how you mentioned giving online services and that how can we leverage technology and artificial intelligence to utilize mental health, and to promote it?
So you asked about two things. One is delivery of services, one is promotion. I think in terms of, I'll first talk about the promotion part, because instead of using the term promotion, I would rather use the term awareness builder. So digitalization has significantly helped in awareness building. So if we can really have people who are trained in it, who know about the thing, use the digital platforms optimally, they can reach to masses. And sometimes these kind of things are like in terms of simplistic ways of telling that in different languages, targeting different people. The more you can use these platforms, you can actually, this entire stigma can be broken only by the digital space, because it's at the end, it's about conversation. We change attitudes of people only through any sort of initiating the idea that something else is also available. There's another way of looking at it. So these digital platforms can be very, very helpful. Now, coming to delivery of services, I think online services had, of course, after COVID, it took like people started using it way, although it was there many, many years back, but then people had been using it, but it may not have been the prime mode of, delivering mental health services. But with COVID, it did come. And what we are seeing, according to recent researchers by American Psychological Association, it's saying that or digital or telemental health, which is like digital delivery of mental health services, it is as effective and efficacious as face to face. Unlike the typical myth that people hold that no, it is not as good. But with a disclaimer. All conditions are not suitable. So the therapist will train to know what is, whether this person is suitable for online therapy or not. So there are some conditions, some individuals, some contexts which will not be suitable for online therapy. But if you do that screening and see if your client is suitable for online therapy or not, it is as efficacious and effective as face to face. And there are some methods, like there are different ways of delivering therapy, different approaches of delivering therapy. All approaches may not be suitable for online therapy. So that is another thing the therapist will choose. Coming to the AI part, I think there it is growing. It is a new space to explore. um, I think YSA is doing a wonderful job with AI in terms of incorporating AI in delivering telemental health services. Um, Now, I think I am not yet aware of the researchers associated with it. I know YSA is doing a wonderful job, and they continuously do a lot of researches and to try to see how effective they are. And but I am personally not yet aware. I've not read researches of how AI is going to help or how it is helping. But I am aware that AI at the end of the day, it's artificial intelligence. It's not going to. It cannot be a replication of human
Yeah.
therapy providers, but it has its own positives. It has its own strengths. So if we know what it is capable of doing, we can actually amp up the delivery of services through that. So if we don't have to see AI as a threat or something that is bad, we have to see what AI is providing, is capable of providing, and then you know modify it according to our needs.
Ma'am, lastly, what would be your message for the World Mental Health Day?
I think World Mental Health. This time we are saying that mental health is a universal right,
Yeah.
and we need to understand that like my only message will be, let's not just look at the physical health. We are so conscious about what we are eating, what we are doing, like we are constantly thinking about that. It's time that we start giving mental health its due importance. We all go through that. We are all aware of that. We know how it feels on the days which we just can't make ourselves go and do things. We know exactly what is going on within us, but we just tend to overlook it. I think it's time that we start first giving it its due importance in our lives and taking care of mental health as much as we take care of physical health. And an urge to all the organizations, government authorities, policymakers to really work hard to create awareness about mental health and make mental health as accessible and affordable as possible. It's just not like one person's job. I think all of us need to work together to do that. If we are saying it is a person's right, then we also have to create a space that they can get their right. Like so many times people they know what is going through them, but they just don't know how to reach out. I can tell you, at least in the past 2 or 3 years, things have drastically changed. So it's very, very, very promising. So we just have to take a few more steps, and if each one can take our responsibilities towards a more aware, mental health affirmative world, then we can probably be where we want to be.
Dr. Sinha rightly told us that love, compassion, and empathy can create a safe space like none other. Let's all pledge to do the same this Mental Health Day. And do let us know what you think about mental health in the comments below. And for more such interviews, subscribe to Daily Salar Digital.